Now let's discuss Chong Mai, or penetrating vessel, as the sea of blood. The penetrating vessel is variously called the sea of blood, sea of the 5 yin and 6 yang organs, and sea of the 12 channels. Chapter 33 of the spiritual axis says that the penetrating vessel is the sea of blood, and its upper point is bladder 11, and its lower points, stomach 37 and stomach 39. Regarding the symptoms of a pathology of the sea of blood, the same chapter says, when the seas function harmoniously, there is life. When they function against the normal flow, there is disease. When the sea of blood is in excess, the person has the feeling of the body getting bigger, and the person is unable to pinpoint the trouble. When the sea of blood is deficient, the person has the feeling of the body getting smaller and is unable to pinpoint the trouble. The above symptoms of fullness and emptiness of the sea of blood are rather rare and not clinically important. And it is not clear how the above points are connected to the penetrating vessel or why they are points of the sea of blood. The most important aspect of the penetrating vessels being the sea of blood is in gynecology. The penetrating vessel has a deep influence on the gynecological system because it originates from between the kidneys. It is responsible for the 7-year cycles of women and for the transformation of kidney essence into menstrual blood, and it flows through the uterus. Being the sea of blood means that the penetrating vessel affects many blood pathologies, which are extremely common in gynecological diseases. The penetrating vessel is involved in all cases of blood stasis in gynecological disorders. To invigorate blood of the penetrating vessel in gynecology, one needs to use the opening and coupled points, spleen 4 and P6, together with kidney 14 and liver 3. The penetrating vessel's control of all the blood connecting channels explains the connection between this harmony of blood in the uterus and the development of muscular pains, something which often occurs after childbirth. It also explains why women often suffer external invasions during menstruation. The depletion of blood in the penetrating vessel induces emptiness of the blood connecting channels, and therefore the space between skin and muscles becomes empty and prone to invasion of external pathogenic factors. Apart from the gynecological system, the blood of the whole body relies for its movement and circulation on the penetrating vessel. Being the sea of blood and sea of the 12 channels, the penetrating vessel controls all the blood connecting channels. The blood connecting channels are the deep level of the luo connecting channels, a level that is connected with blood and blood vessels. The penetrating vessel, through its opening and coupled points, spleen 4 and P6, affects all the blood connecting channels. As these channels are involved in blood stasis, the penetrating vessel can be used to treat blood stasis not only in the gynecological system, but anywhere in the body. Another aspect of the penetrating vessel being the sea of blood is that it is related to body hair. When blood of the penetrating vessel is abundant, it moistens the skin and promotes growth of body hair. If blood of penetrating vessel is deficient, skin is dry and the body hair brittle. Chapter 65 of the spiritual axis says, the penetrating and directing vessels go to the throat, lips, and mouth. If both qi and blood are abundant, the skin is filled and the muscles warm. If only blood is abundant, it will penetrate into the skin and the beard grows. Women have more qi than blood because they lose some of the blood with the periods. Hence, the penetrating and directing vessels carry less blood to chin and lips, and therefore no beard grows. Another aspect of the penetrating vessel, being the sea of blood, is in relation to blood and heart. The penetrating vessel is related to the heart in two ways. Firstly, because it disperses in the chest. Secondly, because it is the sea of blood and the heart governs blood. Because of this connection, the penetrating vessel can be used for palpitations and anxiety during the menopause, symptoms which are themselves caused by the decline of blood of the penetrating vessel, with consequent rebellious qi escaping upwards along the vessel. In the ancient texts, one of the indications of the penetrating vessel is the 9 kinds of heart pain. The penetrating vessel can also be used for irregularities of the heart rhythm. So to summarize, the penetrating vessel as the sea of blood controls blood of the uterus and transformation of kidney essence into menstrual blood, controls all blood connecting channels, upper point of the sea of blood, bladder 11, lower points of the sea of blood, stomach 37 and stomach 39. Blood stasis is central pathology of penetrating vessel. Blood of penetrating vessel promotes growth of beard in men, influences heart blood, palpitations and anxiety, and the heart rhythm.